Treatment for oral cancer often includes surgery. However, in early cancer stages, treatment may be possible with non-surgical methods such as radiation. Here is how to treat mouth cancer without surgery. 1. Radiotherapeutics. Radiation therapy uses high-energy, targeted X-ray radiation to kill cancer cells or slow their spread. Your doctor may recommend radiation in the following situations. It is the first and main treatment for patients with small oral cancer or who are not suitable for surgery. It is used as an additional treatment after surgery to destroy any remaining cancer cells that are not visible during surgery and to reduce the risk of cancer returning to the area. Used as an additional treatment before surgery to shrink larger tumors and reduce the extent of surgery required. To treat cancer that has returned after other treatments. With targeted treatment for patients with advanced cancer who cannot receive chemotherapy. It relieves symptoms of advanced cancer, including pain, bleeding, difficulty swallowing, and the effects of cancer spreading to the bones and lungs. The type of radiation doctors most commonly use to treat oral cancer is called external beam radiation therapy. An external source, similar to an X-ray machine, focuses radiation onto the target area. The procedure takes only a few minutes and is usually painless. Over time, this treatment may make eating and drinking difficult. Radiation can also damage the salivary glands, causing persistent dry mouth. 2. Chemotherapy. Chemotherapy involves a source of anti-cancer drugs that kill cancer cells. According to the National Cancer Institute, chemotherapy is not a standard treatment option for mouth cancer or mouth cancer. Typically, oral cancer that is too advanced for surgical procedures to be effective is treated without surgery. It may help slow growth and make symptoms easier to manage. Alternatively, your healthcare professional may prescribe chemotherapy as an additional treatment before or after surgery. A course of chemotherapy often lasts 3 to 6 months, depending on the effectiveness of the treatment and the severity of side effects. It is important for individuals who smoke to stop smoking before starting chemotherapy treatment. Smoking during treatment may worsen side effects, reduce treatment effectiveness, and increase the risk of infection. 3. Immunotherapy. This type of treatment gives the immune system the ability to target and kill cancer cells. Oral cancer can be treated with a type of immunotherapy called PD-1 inhibitors. PD-1 is a protein on some immune system cells that normally prevents them from attacking other cells. PD-1 inhibitors, such as pembrolizumab and nivolumab, turn off PD-1, activating the immune system against cancer cells. This may slow the growth of the tumor or even shrink it. Your cancer doctor may recommend these drugs if chemotherapy is not effective in treating your cancer or if the disease comes back or spreads to other parts of the body. Some people whose oral cancer has returned or who cannot undergo surgery may use pembrolizumab, Keytruda, alone as treatment. 4. Targeted therapy. Treatment for this type of oral cancer uses drugs that target specific proteins in cancer cells. These proteins support longer lifespan, faster growth, and wider spread. The goal of targeted therapy is to slow this growth and spread and destroy cancer cells. Medical professionals may use cetuximab, Erbitux, a type of drug doctors call a monoclonal antibody, to treat oral cancer. Monoclonal antibodies are man-made antibodies that act like immune system cells. Cetuximab targets a protein called the epidermal growth factor receptor, which is on the surface of oral cancer cells. Cancer treatment teams sometimes combine this with radiation therapy for early-stage cancer. Cetuximab may be used in combination with chemotherapy or alone for more advanced oral cancer. 5. Chemoradiotherapy. This involves giving chemotherapy and radiation therapy simultaneously. It is useful for patients whose cancer in one part of the mouth is too advanced to undergo surgery. It may also reduce oral tumors more than chemotherapy or radiation therapy alone. People may receive the chemotherapy drug cisplatin every 3 weeks during radiation treatment. Other medications or treatment schedules may apply. How long can I live without treatment for oral cancer? In a 2018 study using the National Cancer Database, the 5-year survival rate for people who did not receive initial oral cancer treatment was 31.1%. This decreased to 12.6% for patients with advanced oral cancer. What is the best treatment for oral cancer? The best treatment for oral cancer depends on the type, spread, location, and stage of the cancer. However, most people have surgery to remove cancerous tissue from the oral area. How long does it take for oral cancer to spread? The spread of oral cancer depends on tumor size and cancer stage. The rate of spread may vary from person to person.